Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern Steinberg School of Medicine, who answers your COVID questions every Tuesday and sometimes Fridays on the Harvey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 7th of June. We invite you to submit your questions via Facebook at any Institute for Global Health or by email globalhealthinstitute@northwestern.edu. Leading the discussion is myself, Sophie Bukowski, who's a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics. In the United States, yesterday, we saw 136,000 positive new cases with a 7-day average of now hitting under about 98,000 positive cases with an 8% decrease over the last 14 days. Hospitalizations have increased by 15%, but deaths have overall decreased by 15% in the United States, which is great news. In Illinois, yesterday, we saw 13,000 positive new cases, with cases decreasing by 14%, although there were no numbers taken over the weekend. And the death rate is decreasing by 14%, with hospitalizations also increasing by roughly 14%. What can you tell us about what is going on with these statistics and what the headlines are now saying?
Yeah, it's, all these numbers are not perfect, but there are ways that epidemiologists kind of take that into account, that they're not perfect. And you look at trends, and despite us underreporting the number of cases, what is reported kind of reflects at least what's happening in the total. And I think what we're seeing today, and it's really good news, is that that it looks like it's peaking. And so we've gone from, an average of over 100,000 reported cases, probably many more unreported, but it's now down below 100,000. So, and the way COVID has worked, and this is the 6th wave, there's these peaks and then they come down, peaks and comes down. Now, the United States is so big that like right now we're having more of a decrease in the Northeast. The West is going up. California is doing better than some of the other ones, but it just, we're a very big country. But this is what's happening nationally. The really good news is that even with all these cases, there's even a decrease in the death rate. It's less than 300 people per day.
Yeah.
Now, that's still like one plane full of people. I mean, it's terrible. If you think of the flu, if you look at the average, and now the average is over an entire year, it would be about 100 people per day. But flu is really bunched up between December and March. But if you just look at the average, so we're still quite a bit above the flu rate, which people don't seem to worry about too much. I mean, our uptake in flu vaccines is not very good either, and that helps. But it's looking like we're finally beginning to get some population immunity. I wouldn't call it total herd immunity, but you have 2/3 of adults have taken the vaccine, and the booster rate is now over 40%. So all that's helping. And then the people who are unvaccinated, which is a substantial number, 1 out of 3 people, but they've been getting COVID like crazy. So they have some immunity from the COVID. Now, remember, before January 1st, there was Delta and the other variants, and they're not giving much protection against these Omicron variants. But so many people got infected in January, and then so many people are infected now, and more people are vaccinated, and more people are boosted. All that goes into this big equation, and we're seeing the numbers starting to come down, and we're seeing the death rate coming down. This is great. And I mean, it's a trend, that's terrific. And now, it's summertime. Technically doesn't start for a couple of weeks, but let's face it, after Memorial Day, it's kind of the summer, and the weather is better. Although today in Chicago, the high is going to be 60, I think.
No,
but
it's terrible.
It's June in the Midwest. But people will be outdoors more. They will be, in less high risk settings. but of course that works against you in the South part of the United States because it's so hot that people go indoors into these, crowded places indoors. So, it's kind of all over the place. But anyway, overall, the numbers look much better. And I think this is what we're going to see. We're going to see these waves that come as the new variants come, but with our continuing push to get more people vaccinated, get more people boosted now, that should be the focus now. Getting boosted, and then we'll have new vaccines probably in the fall. And all this is basically how we're going to have to live with this pandemic.
Very interesting. And, this ties right into our first COVID headline and a really interesting number that came out yesterday, which is that the US has wasted over 82 million COVID doses. What can you tell us about this number in proportion to the number that's actually been given in doses to individuals in the United States?
Well, it's very unfortunate to waste an expensive vaccine, 82 million doses. However, let's look at just vaccines in general. First of all, these vaccines don't have a good storage life, the mRNA vaccines in particular. Some of the other ones have better storage properties, but the storage is short. If you look at other vaccines for other diseases where the storage time is short, like with our mRNA vaccines, like the UNICEF vaccine programs around the world. And, that's, they've been doing this for years. It's a global thing. These people, know what they're doing. They're very experienced. They have vaccine wastage rates 30 to 50% for the vaccines that don't have a long shelf life in the storage. So you look at this. So we're, it's 9.5%. I've just read of 687 million doses. In adults anyway, or the people eligible for it. That's a percentage. I've read that the current one is about 14%. So, it depends basically which numbers you're looking at. But, this is not a big surprise to anybody that knows about vaccine wastage. There's a huge amount of literature written about vaccine wastage because, people are investing in these vaccines, the distribution programs, whatever. And so, of course, everyone's interested in the wastage rate. But this is not as much out of line as I think if somebody that didn't know anything about this, they'd say, oh, my God, 82 million doses. It's, look at how kind of haphazard the rollout of the vaccines was. This was an emergency. The medical clinics couldn't handle it. So they developed the vaccine delivery into the pharmacies. This was, really at its infancy before COVID. They were starting to give vaccines in pharmacies, but it was not a very big thing. Now it's like where everybody goes. And that's great that they've evolved into that because there's more pharmacies than there are medical clinics. So anyway, it's not a surprise. And of course we can do better and we should try to do better. But, all things considered, no big shocker.
Very interesting. And, this goes into another big COVID headline talking about COVID vaccine is that the youngest children, so ages 6 months old to 4 years old, could get COVID shots in late June, the White House is now saying. What can you tell us about this information?
Yeah. So they're allowing the pharmacies to order this lower dose thing actually this Friday, this week. And they expect approval by June 21st. So very encouraging, and yet another group that needs protection. These kids are the ones that are normally getting vaccines.
Yeah.
And so, they're all part of the program here. We've got to get as many people vaccinated as possible, boosted when you're eligible to get boosted. because the vaccine, the virus is so contagious now. It's so easy to transmit, and it goes back and forth between different animals. Now some 20 animals, types of animals, species of animals can be infected with coronavirus. So you got animals, you got people, you got all ages of people. You got to get everybody immunized as much as possible. You really don't want to get COVID. Besides just acutely getting sick. Who knows how much of this long COVID is going to be around? Who knows how serious that's really going to be in kids that had it? Who knows, there's so many unknowns, and who knows what the next variant is going to bring. I mean, what's happened so far is all the variants have become more transmissible, but they haven't necessarily gotten more severe. Now, Delta was actually more severe, but then Delta got overtaken by Omicron, which was not as severe. But it was more transmissible. And now we have the BA4 and 5 that's coming. That's even more transmissible than the BA 2.122 or 2.1, whatever it is. I can't remember the number. But that's really the issue. So we've just got to live with it, and this is how we're going to live with it. Get your booster, just like everyone's been saying all along. Get your booster now. Get your booster in the fall when they have a new vaccine out there. You're going to have to just live with this.
Yeah, absolutely. And, going into our first COVID headline, or our first COVID question, this individual says, we hear about new COVID variants popping up so frequently, and I was wondering if COVID is mutating faster than other viruses. I know the flu mutates, but do we have as many flu variants as we do COVID variants? What can you tell us about this really good question, Dr. Murphy?
Yeah, this is a really good, astute question. Yeah, this thing is mutating like mad, and that's because it's so huge. It's such a huge, huge problem. And there's so much virus out there. Remember, the virus doesn't have a brain, it doesn't think, it just replicates and causes damage. So, flu mutates a lot too. Other viruses, some mutate a lot, some don't mutate a lot, but this one mutates like crazy.
Absolutely. Now for our second question, how would Pfizer and Moderna update their vaccine if no one knows what variant will be circulating in the fall?
Well, that's actually not true. We know where these things are coming from. But first, you have to have a surveillance system that's looking for this around the world. Those surveillance systems have improved significantly. Like we know the BA2 came from South Africa, or was at least identified there first. It may have come from someplace else, who knows? But that's also where BA4 and 5 has come from, and is now in the single digits here in the United States, even more transmissible. It's just really wild. So yes, this is a good question. It does mutate frequently, and this is not going to change. And whether it mutates to something that's more benign, let's hope. But we need more than just hope. We actually need some action, and it starts with surveillance and then developing the appropriate vaccines and the appropriate treatments.
Yeah, absolutely. Now for our third question. My grandson will not turn 5 until the middle of August. Is it better to wait until he turns 5 to get the booster dose for 5 to 12? Or should the individual who's 4 years old now take the shot that will be coming out hopefully on June 21st for 4-year-olds?
There's so much happening right now. When he should take this kid should take whatever he can get right away. Now, when this under 5 vaccine comes out, he could take that. And then maybe his second shot would be the higher dose in August. It depends when they actually get the thing. I mean, they could wait till then, but I mean, there's so much being transmitted. He has a high risk of getting COVID now. So there's no right or wrong answer here. The fact and the good point about this is that they want to vaccinate the kid, and I applaud them for that. That's great. I can't tell them what's better, to wait or not wait. These kids respond really nicely to this vaccine. So, I would do the first thing you can get your hands on.
Wonderful. Well, those were all of our COVID questions for today. Thanks, Dr. Murphy.
All righty. We'll see you later in the week.